All right, no debating it. The Kardashians really, they do look good. Okay, Kim Kardashian West is reportedly a fan of this new procedure. It's called Aquagold. It's a facial. She's getting it done before the Met Gala in 2018. And here she is at the ball. Her skin looks gorgeous, right?
Yes, a kind of golden glow.
Yeah.
So how does the Aquagold facial work? Here to tell us, Dr. Adarsh Mudgil, along with this patient, Jean Marie Burke. Welcome. Good to have you with us.
It's really great to be here.
So what's the concept behind this? How does it work?
So it's this little device here is an amazing piece of technology. So what these are gold-plated microchannels that are thinner than a human hair. And we were able to micro-infuse customized solutions into our patient's skin. And really, what's in here is what matters. So
Okay, what's in there?
Yeah.
This one has some Botox and some filler in it, which is hyaluronic acid with some saline. And that does a couple of things. One is the Botox, when you micro-infuse it into the skin, it decreases pore size. It takes
But
about a week.
let me ask you
Yeah.
something. Usually when a doctor does Botox, not that I would know or anything,
Right.
But when a doctor does Botox, they're very precise about where they're putting the needle.
Yes.
This is like, I don't know, you're just kind of putting it on.
It's a good question. So when we're injecting Botox on the upper half of the face, you know,
Yeah.
around the eyes or the forehead, it's precisely injected into the muscle because you're basically trying to paralyze the muscles that make wrinkles.
Okay.
This is very different. This is a very superficial injection, not into the muscle, but right underneath the surface of the skin. And by doing that, it has a different effect. So it's not paralyzing your muscles, it's helping to decrease pore size. The muscles that are attached to the pores, those are the ones that are affected when you inject it into the skin.
So is the vial different for different patients? Is it actually made up for individuality?
Every patient has their own vial.
Okay.
And what we do is, what we put in there is what's different. So in my practice, we use a lot of PRP, which is platelet-rich plasma.
Right.
We use it after we do resurfacing procedures to help to stimulate collagen to form, more healthy and substantial.
Is that with the stem cells or more synthetic, like?
So the PRP actually has growth factors that stimulate stem cells, and that's it's amazing with laser procedures. But you can put anything in there. You could put vitamins in there or serums in there, and that'll give the skin some pop. What's in there is what really exerts the effect.
Can we see how it works now, Doc?
Absolutely.
All right, so did you put anything on her face?
I told her to put nothing on. So
Okay.
no makeup, nothing.
Have you had this done before?
Never.
Oh, are you a little scared?
No.
Okay.
She's in good hands.
So,
I trust
Doc,
him.
how long before you see a difference?
So it takes about a week. So Botox takes a little while to start working. So you'll start, in about a week, you'll notice a decrease in pore size. The skin will also be a little bit doughier because of the hyaluronic acid that's in the filler. That takes about a week to absorb water. So that you get sort of a doughier,
So we're
healthier,
going to look
vibrant
pudgy?
skin.
A little
No,
pudgy?
it's like your skin just looks more vibrant.
Okay.
Oh, it does look,
Yeah.
okay. And how long will it last between these treatments?
You can do them once a month.
Oh, okay.
So the first time, we're just going to prep with a little alcohol here.
Okay.
You okay?
Yep.
So when you compare applying directly the Botox versus this method, is there this method, does it have a...
Totally different indications. Yeah. So
Yeah.
Botox is basically to help treat wrinkles when you're injecting it in. This is
Okay.
really just to give your skin more pop. And something that you can do pretty frequently.
Okay.
So it's really simple. You're basically just stamping the material
Does
into the
that
skin.
hurt, Jean Marie?
Not at all.
Because it's
You
like
okay,
little, it's like
Yep.
little needles, right, in her face?
So these are tiny needles. They're smaller than the diameter of a hair. They're gold-plated microchannels, and you really don't feel much at all. You just literally feel like I'm stamping this on the
So
skin.
you said the procedure usually takes about 20 minutes, right?
Yeah, to go over the whole face, it takes about 20 minutes.
And how much does it cost?
Well, that's what's in here is what determines the cost. So this
Okay.
particular one we're doing today costs about $1,000 to $1,200. If you're having some serums or vitamins in there, $500 to $600. With PRP and laser, it could be up to $2,000.
And actually doing this once a month, spending $1,200 a month for this.
People do it.
Wow.
You'd be surprised.
That's
Yeah.
I mean, I would imagine
I
if,
could
if
see
we,
for like-
we look see what
like
Kim
Kim
Kardashian
Kardashian.
looks like,
Yeah.
it's worth it.
Yeah, I mean, the
Are
results
there any
magic.
downsides, any risks to it?
Zero. This is a lunchtime procedure. So our patients can come in during their lunch break, get this done, and go right back to work. No one will ever know that you even did anything.
So let me ask you something. I know they're little needles and it's gold-plated, but I mean, sometimes you could make marks on a person's face, right?
Well, not really with this. I mean, these are so fine. I mean, they're finer. Each one of these is finer than a human hair. So really, I mean, you'll be a little bit red after the treatment. That goes away.
Let me
in about
see,
15 or
Jean Marie.
20
Do you have
minutes.
anything over there? She's a little red. Yeah. Nothing terrible.
A little cover up. You can put cover up on right after this.
Are there people who, let's say if you have acne or you have some kind of skin condition, that this might really be beneficial for, other than the obvious of just wanting to glow or look better?
That's a great question. I mean, this is really indicated for aesthetic purposes.
Okay.
There's not, you know, for acne, you really want to have sort of acne-free skin when you do a procedure like this, because sometimes this can actually stimulate a breakout if someone's acne prone.
And,
Okay.
and it's temporary, right? I mean,
Yeah.
when do you get the optimal results with this?
So it depends what's in there, but it takes about a week to see the optimal result. And then, you know, over the course of the next few weeks, it starts to fade away. And, you know, for most of my patients, once a month isn't really like a realistic, you know, they can't really do it once a month.
Right.
Maybe a few times a year or before a special event, once or twice a year before the holidays.
Is there like a follow-up that you give your patients after the procedure's done for you to continue at home, just to make sure you're getting the most benefit out of it?
Another really great question. So what everyone should be doing is wearing an SPF 30 titanium or zinc containing sunscreen every day, even if it's snowing or raining outside. And then some kind of retinoid at night. And that's really all you need to do.
Dr.
Okay.
Mudgil, where could people find you?
So my practice is on 5th Avenue down in Greenwich Village, 5th Avenue and 10th Street. I'm also all over Instagram. It's at dr_Mudgil, so you can find procedures that I do there. And we post lots of other fun stuff. And I also have a practice out in Long Island.
Beautiful. Thank you.
Awesome. Great
Thanks
to
for
have you
having me.
on. Thanks for being on.
Thanks,
being a
Jean
guinea
Marie.
pig.
Yeah.